Yeah, it's very prominent. Like the second you lift up the pinna,
Really?
it's like sunken in.
Yeah.
And so in them, they would be, of course, we'd be exposed to, or we'd be more likely to have eczema. They're very prone to getting infections back there because it's so deep.
What
set.
is it? What is it called? Sorry, I just missed it.
Just that when you look at the crease in the back, when it's really sunken in, that's more with like
Turner.
Turner syndrome,
Oh,
Down syndrome, things like that. And mastoid is very important. So anybody who comes, like if you came in with an ear complaint, everyone always is going to jump to otitis media, right? And do you guys know have you guys started ENT? Yes?
Yeah.
Yeah, lectures?
Yes.
Yes.
Okay. So the big thing on exam, how you differentiate otitis media versus externa is what?
We didn't learn that, I don't
I
think.
mean, media is tympanic membrane.
Is all
externus
inside.
canal.
Exactly.
Oh, yeah.
So if I'm pulling on her pinna and I'm pushing on the tragus, she should not have pain if she has otitis media.
Okay.
So, but the difference between otitis media is all what you're going to see on the TM on the inside. If an otitis media sits there for too long, then it becomes a problem, and then you get mastoiditis. So that's why you never want to underestimate what's going on back here. And ideally, this would be red, inflamed, swollen on the bone, the mastoid bone back here.
Okay.
And then, of course, tender when you touch it. But just know that's why we look back there.
Okay.
So the media spread to the external.
Yeah, it sat there for too long, got stuck in the bone, and now went all the way down the bone.
Externa can turn into media, right?
Yes, but not as much.
Okay.
Oh.
So externa, you treat with drops. No need to take oral antibiotics for externa. And most common cause, you guys haven't done this yet,
No.
of externa?
I mean,
Was it be like putting stuff in your ears and just
Foreign bodies.
yeah.
It used to be Q-tips.
Oh.
Everybody wanted to bash on Q-tips all the time, but it's really just swimming.
Oh,
they
were
Yeah.
Okay. Pseudomonas.
Exactly.
That makes
Worst
sense.
case scenario, pseudomonas.
Yeah.
Yes, yes. So swimming, malignant is bad. Bad, yeah. Okay, so then we'll do the hearing. Okay, so the 3 parts of the hearing test. First one is I'm just going to check your overall hearing. Okay, so I'm going to have, you can either have them cover their ear. I think it's better if you do it, to be honest. So I'm going to cover this here, okay, and then I'm going to whisper a word on this side, and I want you to tell me what I'm saying.
Okay.
Okay, so just push on the tragus.
99.
Good. So you are covering, push the tragus all the way in, block your mouth, talk that way.
Okay.
And be at least nowhere near her shoulder.
Okay, so you're not like trying to be in line with her other ear. You're
No.
in front of her shoulder.
No. You're trying to project the sound away
Okay.
and hoping that this one doesn't make up for it.
Okay.
And then you can do the same thing. Pick a different word that'll do
Yeah.
the same word.
Baseball.
Good. Okay, so that's a general like screening test. All right, so now I'm going to do a couple more tests to check and just make sure that there's nothing wrong with your hearing. So the first one is I'm going to tap this lightly on my hand. I'm going to set it on your forehead. I want you to tell me if you hear the sound in both ears at the same time. Okay.
Yes.
Yeah, equal on both sides. You can have them close their eyes if they want to, but if the room is this quiet, there should be no issue. So I'm not very strong. Clearly, I have no muscle mass. That's why that's not very loud. But if some of you get really, really loud, just know that it's going to be awkward. And know that you need to hold down here. If your finger touches any part of this, the vibration goes away. So don't hold it here. Okay? So hold it down here. Okay. And make sure the U is facing out. That's always a point.
So not as opposed to being vertical, you kind of want it pointing.
No, actually, it doesn't matter. So if you wanted to do it here, you could. The more hair someone has, I think it just gets a little bit awkward because then you're digging, because it really needs to be touching the skull. Yeah.
Okay.
So if you want to do it here, you can do it here. Some people actually say you can do it like in the middle of the forehead, although I think that's a little bit awkward. Yeah, so don't do that. Yeah. But I think this is fine for most people. I always put it here just because it's right there.
Cool.
And we won't get docked for putting
No,
it
no.
there? Okay.
But so I think the book will tell you, I think the book or the video will say you can do it here. The only thing is this is a point that the U is facing out.
Oh.
So this is going to get real hard to do
Okay.
if you do it that way. But if you do it here and here, it's okay.
Unicorn word.
Yeah, exactly.
Yeah.
So that's the Weber test. So that's just checking to make sure that the sound goes to both of your ears at the same time. And now we can do another test to double check that. Okay, I'm going to do it again, tapping it lightly. I'm going to put it right behind your ear. You tell me when you can't hear it anymore. Okay. Not very strong. Hear it?
I still hear it. Good. Okay, I can't hear it anymore.
Yeah, good. Okay, so if it's taking practice on each other, if this is taking a real long time and it's like, oh, I still hear it for a long, long time, inch your finger up a little bit. Just slow it down. Okay.
Good job.
But the other, so you can do it this way, or you can do it. But look at that, it's too hard.
Too
So
loud.
just figure out what your
One
preference
question, so you put it on the mastoid
Mhm.
process and you had to just sit in there.
is. Mhm.
Did you were moving away until you said you couldn't hear? Is that what you did?
You
Or
leave
no?
it there.
You just leave it there.
So I double
Just
check that
run
she can
away.
even hear it. Like,
Okay.
do you hear something? Yes. Okay, let me know when you don't hear it anymore.
Okay.
I don't hear it anymore. Put it right next to her ear, U-shaping forward.
Got it.
Facing forward,
And
sorry.
you would know it's conductive if it just felt extra loud to her.
So if it was,
They don't hear it.
right. Yes, I hear. I don't hear it anymore.
And then not when you
I hear
pull it.
nothing.
I hear
Okay,
that.
okay.
Yeah.
Cool.
Okay. Not too loud, right?
No,
Can you hear? Okay.
it's fine. Still, okay, it's gone.
And you guys can cheat on each other if you want to. I mean, that's going to be the part that slows you down on the OSCE. So
Okay.
if it's
That was
taking
like
too
1
long,
second though, right?
Exactly.
And then you said
Yeah,
just
exactly.
inch your hands up.
Exactly. Just
Do a little circle.
Stop it. Yeah.
Stop that
Just-
vibration.
Let's hope you don't get that one SP that's like, I don't hear it. I don't. Okay. And we're doing it again. Okay. So
It's okay.
otoscopy.
You're fine.
You know, there's those SPs that just take their job
Yeah.
very seriously.
Oh yeah.
Okay. So like I said, whichever way you want to hold the otoscope, here, upside down, it doesn't matter to us. Okay, just pick a way that it seems more comfortable to you. Actually, let me put the insufflator on so I can show
In
you
regards
that.
to being in a clinic
I'm
where
gonna
it's
use
on a
yours, is
wall,
that okay?
in regards to being in a clinic where it's on an actual cord,
Uh-huh.
what have you found to be the most practical? Because I know that like, you're gonna probably have to, like, if you're trying to just keep it in your dominant hand, you go over to this side, and it's the cord is pulling the tension on over
Yeah.
here. I don't know, like, is that practical?
The cord is pretty. It stretches pretty far, and
Okay.
you're not that much different this side. Oh, it's not that much different from side to side. So it's a thank you. Oh, sorry. I think it's okay. I think the difference between you holding it this way, or this way won't really
Okay.
matter. Yeah. Okay. Let me make sure I'm commenting on all the things you're supposed to comment on. Finger stretch, and look at all the things, and that's really it. So this should be super, super quick once you guys get the hang of it, okay? So you're turning it on, however you want to hold it. You're going to use these 2 fingers to pull the pinna. Keep this one between your pinky and your ring finger. Light puffs. So practice that you have the strength to do that because, you know, those are like our 2 weakest fingers. Okay, so now I'm just going to look inside your ear. I'm going to be looking at your eardrum, okay? This should not be uncomfortable, but please let me know if you have any pain. Okay. So this ends up going down, like in your hand, which is totally fine, right? Because you don't need that much distance here. So move the tragus out of the way, set it right inside the canal. And all you should have to do is pivot your hand. You don't need to go in further to see the canal. Just move your wrist, but leave it right there. So if you brace it on the tragus and the canal, you okay?
Yeah.
Okay.
It's fine.
And I look up, there's her TM.
And you do the same technique for pediatric population as well?
Yep.
Okay.
Yeah, because in peds you got to get in and out
You
like,
gotta get in quick, yeah.
So this is what I do in my work. You look good. Awesome. Because that's what do I need to see? It's I either saw the light reflex and it was bright red, and usually you can see it's bulging, and then I get out and then I know it's infected.
Okay.
So
You know,
that seemed like it was kind of an angle, not totally fully up. Did you
This
start
way?
up?
So her canal goes like this.
Uh-huh.
So hers is not straight like this.
Oh, okay.
Peds is very straight.
Oh.
As you get older, everybody's moves in
Oh,
a certain
okay.
direction. Yeah, there's nothing wrong with you.
Oh,
okay.
Goes to that 45.
Yeah. So that's why in peds it's better to pull down because you're trying to like move things out of the way.
Got
But in us, we're trying to make it as level as we can. So some people you end up pulling. Am I hurting you?
No.
You end up pulling really high up to try and straighten it out because
Okay.
most people's canal is like this. It's just a
Okay.
matter of how narrow or how steep it is. Okay. So tragus, canal. There's your TM. Okay. Oh, I'm gonna let go already. Sorry. You okay?
Oh yeah, I'm fine.
And quick little puff of air. You okay?
Yeah.
So her canal is pretty narrow, so she could actually get away with a smaller one of this and be just fine. Is it okay? Was
No, it
uncomfortable?
wasn't.
Okay.
It was just
Did it
fine.
tickle?
But just as a standard, should we use the long one?
Which one?
The long
Thank you.
thing at the top.
The thinner one? You mean?
Yeah, the thinner one.
I think the middle one, the one that's on that one, is
Okay.
probably that's the same one. I don't know. This is bigger than what I use anyway every day.
Yeah, I have small
Um,
ears.
I can see
I feel like
pretty much anything with the medium-sized one, so you
Okay.
guys will be
My
able to
mom's
too.
ears are smaller than mine.
The other thing I was going to tell you guys is if you need to let go of the pinna to do this, no biggie. In my opinion, I mean, you'll talk to other people, I'm sure. People will say, okay, then you lose the TM. But I think once you saw the TM and your speculum is still in the same place, you dropping the pinna so that you can have your hand free for this is not going to affect your visual field at all. If you moved your hand around and lost the TM, then I'd say, yeah, then you just lost the whole thing. But once you get it, set it in there. Okay, I see the TM. If you want to let go of the pinna and just use your whole hand for this, that's fine.
And in regards, the whole tympanic membrane should be retracting back, or are you looking at like the pars flaccida, because that's like
you're looking at the light reflex.
Oh, the light reflex.
That's the part that's going to be most noticeable to you. So on her, it's a little bit harder to see her whole TM unless you really get in there. But you can see pretty much 3/4 of the top part of it. Now, if you move a little bit, then you get that bottom corner. So really, I just wanted to look at the bottom and make sure that wasn't red. But her light reflex is like, so if here's her TM, I could see about this much of it. If you move slightly, you can see the bottom. Her light reflex is here. That's what you need to look at when you
So did it flash?
Okay. Well, it just moves really quickly. Yeah. And it takes a lot of practice of over and over different years all the time to know. Okay? And then you're going to do the same thing on the other side. So regardless of whether you're right-handed or left-handed, it shouldn't be any different. Just know that on this side, it's going to be a little bit different. Oh, I took the thing off. So sorry. They're so much fancier than once I have that work. Okay, so then your hand's going to go like this, right? So if you want to do this hand, although I'm incompetent with my left hand, so I'm not even going to try this. So I'll just bring my whole hand over and do it this way. And in which case, now my finger strut is back here on her mastoid. Okay. Same thing though. Tragus goes out of the way. Canal is there. And there's her thing. Sorry, my finger. Little puff. You okay?
Yeah. I was going to help you find it, then I was like, no, she can do it.
So opposite hand for puff on that side.
Yeah.
Okay.
Makes sense?
Cool. I like
Cool.
that.
Okay. That one is a little bit easier to
Just
see
do
on
that
the side.
and switch, keep it in my right hand always.
I like that better.
I don't want
My
to move
left
the
hand
patient.
Yeah, and ideally try to keep your hand steady. Like once you get in and see the TM, leave your hand there. Don't
Stabilize.
Yeah. Okay. And then the nose is pretty straightforward, so I'm just looking at your nose. Sorry. Making sure that it's in the center of your face. I'm just gonna feel down the bony part. Have you ever broken your nose or had any trauma to your nose?
No.
Good. Okay. Perfect. And I'm gonna have. So we were just talking about this before we came in. So apparently they want you guys to occlude. I think that's a little bit odd, but so I'm gonna put my finger and block one of your nose.
Okay.
Okay. Nostrils. Can you breathe in? Good. I'm just checking to make sure that's nice and clear. Same thing on the other side.
Breathe out.
Good. Now you gotta wash your hands. That's all.
Yeah.
So I don't think there's
Wash 'em.
anything wrong with the patient doing it. They said that's fine. The preference is that you do it.
Okay.
That was
So
the
they
verbiage
don't
that we
cheat.
discussed. That's
Or
exactly.
something.
Which let me tell you, they're not going to cheat. They don't even know what you're doing. So patients are not going to cheat, but that's what we discussed. Okay.
So if they have allergic rhinitis or something, it'll just be harder to puff out on the ear they're trying to
Puff in.
Puff in.
Don't make them puff out.
Oh.
Yeah,
You'll get
'cause
a
then you don't even know what's coming out. Yeah, so
Okay.
always in. And you'll hear it just fine. Yeah.
Okay.
So in both sides. And then for palpating the sinuses, you can do it 2 ways. I think the book shows you with your thumbs. I'm going to have you take your glasses.
Oh, yeah.
Is that okay?
Yeah, I
Sorry.
got it.
So I think the book shows you like put your hands on their scalp and like push up on their sinuses. So that's one way to do. You're almost like pushing on the like part of their forehead and pushing up. Any pain when I do that? Good. And then again. Any pain when I do that?
No.
No. You can also just do this. Because let me tell you, your sinuses are super, super tiny. They're like this tiny. If there's food in there, it's uncomfortable no matter what you do.
Right.
So you using thumbs versus this is no different. Okay?
Got it.
Whatever you prefer. And then your transilluminator. You guys have that?
Oh.
So we only have to palpate then frontal and maxillary. We're not
That's
dealing with
yours.
the ethmoid or.
Can I do
No.
yours?
No.
It's too
Mine
low.
is in the
Yeah, you
box.
can't see it anyway.
Right there.
Okay.
Those
Yeah.
green boxes.
And so the most common places for sinusitis anywhere are frontal and maxillary.
Okay, cool.
Yeah. So I think one of your questions on your checklist anyway is, are you having any tooth pain,
Yeah.
difficulty chewing, you know,
This is
congestion,
yours.
things like that.
Oh,
So if
this
they've
is
already
yours.
said that, then you kind of know if they're having pain when they're chewing, chances are you might feel a little bit of tenderness when you start pressing on the maxillary ones, but probably not up here. These are much smaller, and they're really only, sorry,
No, you're fine.
they're really only right here, like to about halfway through your eyebrow.
Okay.
The maxillary ones are big, they're kind of start here and they go along your jaw.
Cool.
Okay? You should press pretty firm, which is why you kind of need to brace your your hand on their
the
head.
head.
So if you want to do it one at a time, which I just realized I do, I brace it back here because I think the more pressure, the better.
Okay.
I kind of like how that is.
Better,
Yeah.
less uncomfortable in the
Yeah,
in the
less
face.
that.
Yeah, that's what I think too.
I like that.
Okay.
Thank you. There you go.
So transilluminator. If the room is a half dim, you guys are fine with that.
Yeah, I just think
Okay.
it's bright.
Yes, sorry. So just let them know you're going to be shining a light up into their sinuses. It is next to their eye, but it shouldn't cause them any, pain or anything with their eye. So what you're going to do is you're going to put your hand here, like on the eyebrow itself, okay? The light's going to go up and under her eyebrow and shine up to the sinuses. And you can see hers is completely patent. So the difference is if I do it like this, then I don't even know what I'm looking at. I'm looking at her eyebrow. But when you block it, now I know it's fine. And see how tiny the sinus is? It's super tiny up
That's
here.
teeny.
Yeah, compared to how much you're going to see in a second.
Yeah.
Would you instruct the patient right there to close their eyes?
If you want, you can tell them.
Okay.
Yeah, if you want. Is it uncomfortable
No.
to have it
Was it
open?
fine?
I didn't feel anything though.
So if it's a smaller amount of redness, that means there's fluid in some.
Yeah, so
area?
you want the glow to be
To match.
circular.
Okay.
Yeah, so if all of a sudden it's just like a nonstop
this,
horizon, I'm
kinda?
sorry, nonstop horizon, that's fluid in there.
Oh.
Yeah, which is a little bit harder to see frontal than it is maxillary.
Mm.
And then this side. So if you did it on the right side, that's a good question. If you did it on the right side and they were like, that was really bright, then say, okay, this time you can go ahead and close your eyes. I'm going to do the
Okay.
same thing. Block it. Do it quickly. That one's a little bit bigger. Can you guys see? You guys can always turn off the light if you want to because you have the window in this room.
Yeah, it is a little bigger.
Yeah.
How did you describe it? Like something
Yeah, the
Oh,
horizontal.
no. So if there was fluid.
Yeah.
If there was fluid, it would be a dark horizon. So see how her, you okay if I do it
Yeah,
one more
yeah,
time?
I'm
Sorry. Her right sinus is not nearly as big, but there's no darkness in there. There's no like
Yeah.
shadowing at all. But then when you do this side, sorry, one more time. See how much more glow it is?
yeah.
It's just a bigger sinus, but there's still no dark shadow in there. And so usually with the frontal sinus, because what happens is your nose gets congested, the fluid backs up into your sinus up here, so it ends up being this really dark horizon with just a teeny glow on the top. Whereas this one's going to look completely different. So this one, so one more time I'm going to look at these two sinuses. Okay, so I'm going to put the light on your cheek. And, yes.
Okay.
I'm going to have you open your eye or your mouth, and I'm going to look inside. So you're putting it on the jaw, looking inside. Sorry. Oops, hold on. I'll burn you. Not getting a good look. So sorry.
I don't
I
have
don't really
them.
see
I'm
it.
just kidding.
You do. You do. This is completely patent. I'm just not seeing it. I see it much more in your sinus right there than I do. Okay, you can see it better on that side. I think you guys okay? I'm very much about the dark room.
Do we have
Okay.
to do it on both sides?
Yes.
Yeah.
So look. So you guys are gonna look at her palette on that side.
Yeah, you can see it.
Yeah.
Nice.
See, it's so much better with the dark room. Same thing on this side.
Yeah. Cool.
Cool. That's what
So you
you're
put it
looking
like right here.
for. You put it right on the start of the maxillary,
Oh,
the
okay.
jaw right there. Yeah.
Okay.
Shine it
What
down.
was the pressure like?
Is it too much? Sorry.
No, it wasn't too much. It was
But
just
you
like,
push on it.
yeah, she's pushing on it. Yeah.
I think
But it wasn't
you
too much.
you could. I could probably do it lighter. Sorry. I'm trying to think. I'll do it lighter. Tell me if you still see it though. Can you still see it?
Yeah.
It's okay. Is that better?
Yeah, that's fine.
That was better.
Mhm.
Okay.
And then for
Sorry
the
about
eye,
that.
you just put it like right here.
So you put it right under the eyebrow, shine
Okay.
it up.
Yeah,
and then
she
block
was
it with
more
your hand.
medial.
Yeah. So it's right kind of where the eyebrow starts. Sorry about that. Going up.
Nice.
Okay. Don't dig in the skin. I'm just showing you that you kind of.
So that one's going up and this one's going down,
Exactly.
Oh, down.
which makes sense.
All right. And then the nose. You guys have your nasoscope. Sorry, I'll have to mix everybody's things up.
You can use mine.
Which one's yours?
Just clean that afterwards.
So the thing to practice so that this doesn't slow you down on the OSCE is do that at home.
Okay.
How quickly can you change out everything? Because there's so many different pieces to this OSCE that you don't want that to be the part that slows you down.
Yeah.
What do we just get like an alcohol wipe to clean these
Yeah.
things? Yeah.
Yeah, because it's so big. I mean, you could even get a Q-tip and clean it out first and then just wipe it off with alcohol.
Cool.
That's good too. Okay, so you already felt the
Are
bridge
we
of the
are we
nose.
cleaning it during the OSCE?
No,
Okay.
No, don't waste
Okay.
your time.
Okay.
Burn it.
In real life, you could actually use your otoscope, change out the speculum, and do it that way too.
Okay.
I think for the OSCE, they want you to do this. And this is better anyway because it's bigger. You can
Okay.
see much more of like the
And
near
you practice, do you guys stick like anything plastic under, like disposable?
Under here, no.
No?
And in practice, nobody has these.
Oh,
Unless it's like a fancy office.
oh.
Yeah, so I use that.
Okay.
And I just change out the
Put it in
display.
your nose,
Yeah.
your schnoz.
So the difference
I've always
is,
seen
know,
that.
nervous.
I
I've
know,
always seen
yeah,
that.
nobody has this. ENT has this because they can see everything with this, but nobody else. But it's very nice
It's
for you
okay,
guys to
our
practice.
noses are all good.
Exactly,
We all got
exactly.
boogers.
Nobody's
I
gonna
don't
have some
know.
giant
I want
polyp
to
up there,
try
hopefully.
it.
You're so worried.
It's awkward with the nose.
It is, I know, it's okay. So what you're gonna do is you're gonna brace their head a little bit. You're gonna have them bend their neck back just a tad. I'm gonna just lift up the tip of your. I know it's so weird. Lift up the tip of your nose, and I'm gonna look inside. Okay, just setting it right inside. Again, right inside the nary, and then look up. So you guys can see her turbinate is pretty inflamed.
Is it?
Yeah, you can't.
Oh,
you
yeah,
can't
it
see
is.
past the turbinate.
Oh my god.
That
So-
guy, yeah, that
yeah.
guy's
You okay?
No, it's fine.
That's the
yeah.
inferior,
You can look at
or is
mine
that the
too.
inferior
I
turbinate?
have
It is, yeah. So most people can only see the inferior turbinate. If her
Oh my
turbinate,
gosh, this is going on the internet. You can see it. No, you can see it. It's just a reflection with the camera. Sorry, that was fine. At least I'm already married. Okay.
let's do the other side. So normally, what you would be if the turbinate wasn't enlarged, you would see the inferior turbinate. You'd see a small bit of the one right on top of that, and you could see the septum. So the idea is that nothing is on the septum, right? It's not perforated, which it shouldn't be. It's not deviated, which you would be very noticeable if it was deviated. And then if you saw a polyps are up here more, right? They're up at the top. So if her turbinate is inflamed like it is now, I can't even see up there anyway.
Yeah.
So you can determine, when you comment on your note, you're going to say inferior turbinate, edematous, erythematous, but nostrils patent. And you know it was patent because you already did this.
Yeah.
So I would say it's not patent because I can't see beyond that turbinate. But in terms of what she was able to do when she smelled, she's fine. So patency is what she is able to do, not what I can see. Does that make sense?
Patency is regard to airflow going
Exactly.
in. Okay.
Right.
Okay.
So despite her turbinate being, and that might just be her baseline. I don't know. I've never seen
Yeah,
her
I'm not
turbinate.
sick or anything.
Yeah. So that's just, most people have that. Okay. And then we'll do the other side. One more time.
That's
Go
fine.
back. Lift up the tip a little bit, and then go. And then same thing on that one.
What do you mean by inflamed, whatever you
So see how all you can see is that turbinate right there in the front. You cannot see anything above it.
Oh.
So both are
You
inflamed.
can't see the whole
Yeah.
way.
So normally, So
I want to look too again.
normally, you could see beyond that turbinate to the turbinate that's on top of it up here,
I
and you
won't,
cannot.
I won't put the camera on.
Oh, sorry.
That's so sick.
Okay.
So see.
All my nose hairs and whatnot.
So yeah, usually you can see two turbinates. That would be like, I'm not going to say normal because there's no such thing as normal, but that's typically what you would see is the septum, the two turbinates, and then if there was a polyp, it'd be way up at the top. Okay, cool. Anything else on the nose? No, patency of turbinates.
And for our sake, are we announcing all this to our preceptor, like checking for polyps?
No, you mean talking to us
Yeah.
over here in the corner. At
Yeah.
the Oskies, is that what you're talking about?
Sorry.
Yeah, that's okay. So what I would say on this exam is I'm just going to look at the inside of your nose. I'm just looking at the different structures and just noticing how patent your nasal airway is. And then you can say, and that's about it. If you say that, I know what we're looking at. And then
So you don't
we
have to
already know
talk.
you're looking for nasal polyps. So I wouldn't even throw that word out because it's very scary for a lot of
Yeah.
people.
Mhm.
So you've already done your history, so you already know if they have nasal congestion. So you can, if you felt like you were super comfortable with Oski and you have some nasal congestion, so these are the reasons why we look at the turbinates and different parts of your nose. You never broke your nose, you never had any surgery in your nose, so your septum is intact or whatever. Just kind of make chit chat. Then it's kind of like you're making chit chat to them, but then I know what you're saying over here because we don't want you guys talking to us.
Okay.
Right. And saying all these things, and you definitely don't want to use the big words that are going to freak them out.
Okay.
Polyp is going to freak them out. Okay, and then the mouth.
I have lots of fillings.
Nice. I like the mouth.
Cavities
That's
in every
good.
tooth.
Really?
We did not use this in your hair. We didn't even.
We didn't do it. No.
Okay. Okay. Cool. So basically, what you're going to do is and you can either do this two ways. You can either do all of the inspection up front, comment on the ears, comment on the lips, comment on the face, do all that in the beginning, and then actually start examining each spot, or you can do it all at one time. So now, if you did it the other way, you go back and say, now I'm looking at your lips, looking for any dryness. Your lip is a little bit dry. Yeah. That's not offensive to people. So I'm gonna look at the inside of your mouth. If I could have you just lower your lip A little bit. Good. I'm just looking at your gums. I think they want you to use your light, even though you could totally see it without the light.
So you can
I'm
keep
just-
that head on.
Yeah, whatever one you, or your pen light, whatever you guys prefer.
What is this?
Sure. Thanks.
There's lots of light.
All right. So you're just looking at the gums and looking at the bottom of the lip, the color. Good. And can you do the same thing on the top lip? Awesome. Thanks. Same thing again. Okay, good. So now I'm just going to look a little bit more in the sides of your mouth.
Okay.
Okay. This. Okay. So now I'm just going to have you open your mouth, just nice and relaxed. I'm just going to look at the side with this tongue blade, okay? So you want to look up at the gums in the back because you couldn't see that with her lifting her lip. Looking at the buccal looking at the bottom. Good. And then same thing on the other side. You doing okay?
Mm-hmm.
And see how she has, I don't know if you can see her. See how she has that, the line? That's like where your teeth naturally hit your buccal mucosa.
Oh.
Most people should have that. The white line on their side.
I can
Oh, I
feel
see
it on
that.
mine.
Yeah.
Uh-huh.
I chew my cheek, so mine
I
is like
do.
mangled.
I sleep on that side.
Oh, that's why. You can't see it on your other side
Yeah.
at all. Okay, so then now you're going to look at the back of the mouth. So the whole, we're done with this. The whole stick out your tongue and say ah thing does not work. It does not drop the tongue. If anything, it makes your tongue even bigger. So the ah part is actually just to move your uvula. That's the only purpose for the ah. But if you really want to get a good picture of the back, rather than have them stick out their tongue and say ah, it's better to leave your tongue in the floor of your mouth and say ah. And have them push their tongue against their tooth. Ah. And then everything comes into view.
Okay.
Okay. Good. So you can see the back of her pharynx. I can see the your tonsils are super teeny. You guys can see? Can you? So when she says ah, her uvula comes up. So your uvula is actually kind of retro, like
Back.
angled. It is.
Okay.
It's not hanging straight up in the front. So when you first look back there, you can't even see your uvula. And then when you say ah, it like comes up into view. Yeah, it's kind of
There's a
cool.
little petechiae in the back, the little spots, or no?
It could be, yeah.
Yeah, again.
Or no?
No.
No.
So her arches are a little bit like purple. You guys
Okay.
can see that? Like it's a different color than the rest of her. That's pretty common.
I can show you guys something weird.
Okay.
Wait,
I'll pause
No,
it.
I have these little pocket things, like, and they're like little holes, and like you can see them when I like do that. If you look
Okay.
where the pillars are.
Mm-hmm.
So
Not your tonsils.
I think it's
it's
right
below
next to them.
Okay.
They're like holes, and
Do-
food will get stuck in there, and I have to
Oh.
like get it out, and it's horrible.
Do you want to down?
Uh,
I don't see it.
when I do that, usually in the mirror, I go, and then I have to get it out, and I like gag myself, and it's really
You
hard.
can probably feel it more than we can see it. I don't-
Yeah,
I
but
don't
you can see it. Maybe because there's nothing in it, so you can't see it.
Okay. Okay. But you guys could see her tonsils.
We
Did you
could
see
see
her
it,
tonsils?
yes.
Yeah. Okay. So those are things you're looking at. Is you're looking at the color of the tonsils. Are they enlarged? You'll know if it's enlarged because they start to look more like rounded. Hers are kind of like flat and collapsed. That's like the normal tonsil. So her I wouldn't even say that's a 1+ tonsil because when you start doing 1+, 2+, 3+, 4+, do you guys learn this yet?
Not yet.
Oh, okay. So 4+ is kissing tonsils, like they're literally touching
my
each other in the back. 3+ is nearly kissing. Sorry. 2+ is they're pretty big but nowhere near, and then 1+ is they're just starting to get more rounded. So hers are just flat, collapsed, normal color tone. Do you see it? It just looks
Yeah.
like fatty tissue on the side.
Exactly.
That's
yeah.
nothing. That's not a 1+ or anything. And then yours, if you have allergies, yours are probably going to be cobblestoned, like pockets
Ooh.
all in them,
Oh.
different pockets
You
than what
can
you have. So people who have allergies usually have at baseline 1+ tonsils, and then they look like there's like little craters all inside of it, and that's called
I've actually felt
cobblestoning.
that before.
You felt it?
I feel crater things, but I
What are you
don't
doing back there?
I
Oh,
can
it's
feel
tongue.
it. It's
It's
a soft palate.
weird.
thing.
Yeah, I know what you're doing.
I can feel it.
It
Be
feels
very
itchy.
evident.
I've done that before.
Because I get allergies.
Yeah, where your throat
That
like
might be.
feels itchy kind of.
That might be. That might be. Okay. So you do not need to stick your finger in and feel the side. Okay. Now, if they had a complaint where they were having like a nodule in their cheek or something, or they were having pain in their cheek, then you should put a glove on and start feeling the buccal mucosa. But you don't need to do that. Okay. For the most part, you can just look around at everything.
But
The tongue.
I have a question. Like, are we
The
going to be
tongue, yes.
verbalizing everything for the mouth and throat?
Yeah, I would just, you don't need to say everything that's on this list. So you're just going to be looking at the inside of your mouth and looking at the color. It's nice and pink. We're looking for any signs of infection in the back of your throat, and leave it at that. Your tonsils don't appear to be enlarged. You can say all that either while you're doing it or when you step back at the end. I'm going to leave the tongue for the end because it's a little awkward.
And I have sores on my tongue right now.
Oh, sorry.
In
That's
regards to like looking at the lingual aspect of the teeth, you just Just trying
Those
to
hurt
shine in
so
there and
much.
have a
Yeah,
little tongue
they're
out
so
and just
annoying.
come
Yeah,
with it.
exactly.
Okay.
So let's look at the ducks because that's the easier thing to do. Okay. So first thing is Stenson's duck, which is up at the top, which is a little bit hard to find on some people. So say it's gonna be up. You can't see it on her. So it's a little bit higher than where that line is where you bite your cheek. It would be
What's it called?
the Stenson's duck is up here, like way in the back. It's a little bit. You can't see it, but that's where it would be. See where that white part is?
Yeah.
Typically, it'd be there. It's a little dot.
Oh.
And then same thing on this side. Oh, you can see that one. See how there's that little
yeah.
bolt? Yeah,
Yeah.
right there at the top.
Hey, Charles, I think
So that's Stenson's.
Cool.
So that's the Stenson's one, and then Wharton's duck is under the tongue. So now you can see I'm looking at underneath your tongue. Lift up your tongue. Good. And it's those two little dots on the side of the frenulum, on the side of the floor of the mouth. Hers is more on the frenulum. See how she has these little like bulges on
Yeah.
on her frenulum,
Mhm.
right there and right there.
Yeah.
Those are the
So
Wharton's
that's
ducks.
from.
Okay. Maybe it's more
Is
than
that your
two.
submit? So you have your parotid that goes to your
So that's sublingual.
Stenson's duck.
and then the one that's going to the Wharton's duct would be your submandibular.
Exactly.
Okay.
Right. So that one is the one that can get a stone in it.
Yes.
You can get a stone in actually either one.
Isn't
The
it?
salivary
But then that one is like
Sublingual?
sialadenitis. Yeah, you can get stone down there too, which you're not going to see. You're going to feel it when you do the thing in a second, which is a little awkward.
Do we
Sorry.
put gloves on for that
Oh
one?
yeah, for sure.
Okay.
So you are not going to comment on their breath, but you are going to notice their breath. Okay. So I don't know if it's one of your questions in the beginning or not, asking them like, have you noticed any changes in your breath or taste or things like that?
Yeah.
That should already kind of be out there, and
So we're
chances
not
are you've
gonna,
been in this region for a while at this point, so you would already notice that. Do not say anything to the
we're not
patient.
gonna do like a
really?
sniff.
No.
Like
Why
It's
Yeah,
not
why
going to
not?
be a point. I guarantee. I will find
Okay.
out. It's not going to be a point. It's never been a point in the past.
So they
'cause
don't
there's
have this. I imagine the. Oh, I actually see it. Yeah.
We have that, but that's not what we're grading on.
Okay.
We have a separate like Scantron. Okay, so let's do. Okay, so the last thing is you guys are not going to feel TMJ. Sorry, we did in the past, but I guess they're going to move it with a different OSCE. So what you're going to do is that you're just going to have them. Can you open and close your jaw a couple times? Good. I'm just checking to make sure that you can do that fully. Good. Okay, now what I'm going to have you do is typically people can open their mouth as much as 3 fingers. If I could have you open and then just put right on your teeth. Good. Perfect. Good. That's it. A little awkward, but at least it gives them something to do. And then you're going to give them some water at some point. Make sure they'll have bottled water, but you're going to give them some water. And I just want to check to make sure that you're having no issues swallowing. They'll take a sip. You watch them swallow. Obviously, they're not going to choke. And then you'll do the tongue. So the tongue.
And then we check for that thyroid thing going
Yeah,
up.
leave
and
that
down.
till the end. Though.
The end. Okay.
Yeah, because the thyroid is a hard thing to do, and so I'd rather you guys get all this other stuff out of the way and then leave that for the very last.
Got it.
So the tongue is when we start wearing the gloves.
Yeah.
Because you have to like pick it out.
Yeah, so you can either do this first and then fill the roof of the mouth, whatever you want to do. But I think it's all a matter of your comfort level. If you're holding the gauze like this, I don't think you need a glove on this hand. But I tend not to be a very germophobic person. If you would like to, by all means put another glove on. So this is the one that's going to hold the tip of the tongue. This is the one that's going to feel the edges of the tongue. Okay? Okay, so I'm going to have you, and this is a little
That's fine.
awkward. Usually dentists do this, but we're going to feel your tongue and just make sure there's no abnormality. So I'm going to put on the tip. Actually, this is way too big. Sorry.
That's fine.
Take it out. Good. And then I'm just going to feel the side of your tongue. Good. Same thing on this side, all the way back. And then lift it up. Good. And then what you want to do is you want to just pinch a little bit on the tips, because if she had a nodule, that's how you're going to feel it. Okay? And then you can already feel it. I'm sorry. No, it's
That's
awkward.
fine.
It's so awkward. I hate it.
You can already feel the tip because you're
Exactly.
pressing.
You can feel it with your fingers. With your gauze.
Okay.
Okay, so now what you're going to do is, now I'm going to, you can leave the same gloved hand because it's her mouth. Nothing happened. So now I'm just going to feel the floor of your mouth. Okay? And I'm just feeling for any lumps or bumps at the bottom. You're going to feel a little pressure, but it shouldn't be uncomfortable.
Okay.
Okay? So what you're going to do is they're going to lift up their tongue. You're going to do that side first, because or whatever side you want to do, I should say. This finger is going to come underneath her jaw. So between where her tongue is under here and her jaw, there's a little crevice. Your finger needs to go there. I tend to do everything with my middle finger, sorry. So this finger is going to push up. This finger is going to try to meet it on the inside and push down twice. Okay?
Oh.
So it is pressure, but it shouldn't be painful. If you start digging around with your finger, that's when it gets painful, okay? But if you make a sandwich like this, I need to get a different glove.
Spreads and
Sandwich,
six,
yeah, and you're done. 1, 2, 1, 2. Okay? That's what you want to do.
I've never had anyone do this stuff.
The dentist should do
Yeah.
it. Did your dentist not do it?
Uh-uh.
Oh my gosh!
I go to twice a year since I was a baby.
Oh my goodness! I didn't ever pay attention to it until I went
Maybe
to PA
they
school,
do.
and I was like, oh, this is
Yeah,
good.
maybe they
They're
do.
supposed to do it.
Okay.
I
Yeah,
bet they do.
they should. I mean, it's super
They're
quick.
just like,
Yeah.
Okay, so I'm gonna have you lift up your tongue. My finger's gonna go under here. A little pressure. Sorry. Good. You okay?
Mhm.
Okay. Little pressure. You okay?
Yeah.
Good. I feel nothing. Okay. And don't be a wuss, because otherwise there was no point to that whole exam. If you're just like,
So you would just feel a nodule or something?
yes,
Oh,
but it's
okay.
not gonna work if you don't do anything with this finger. So
Got
this
it.
needs to push up, and that one needs to push down. You need to try and don't try and meet them. That would be really
So
uncomfortable.
what
But
gland were you checking there?
you're not checking glands. You're
Oh.
feeling for any masses, because
Okay.
oral
They
cancer
can be
tends to
hidden.
be down there,
Okay.
and no one checks there.
Okay.
Got it.
Gone
Center of the
deeper.
dome, yeah.
Okay.
And then nodes, and then thyroid, and then we're done. Okay. So nodes.
Yeah, you don't.
Okay. So nodes, I would do them all at the same time. Obviously, I think they probably showed you these two fingers. Whichever is more comfortable for you. I think these two fingers are easier for me. Whichever one works better. I would do 3 fingers. That's kind of big. And you're going to do circular motion. This is not a way to feel lymph nodes. You will never feel anything. Think about all the distance that you just missed doing this little
Yeah.
thing. And I think the video, or at least back in the day, used to do this.
Yeah, he was stroking.
No, you will never feel anything that way. I don't even know why they show it to you. Okay, so first one is preauricular, which is right in front of the tragus. Circle, circle, circle. Postauricular is on the mastoid. Occipital, you might as well just do right now. It's basically walking along the tip of the occipital bone in little circles all the way across. So meet your fingers, go back. Okay, so you're already on the, holy heck, mastoid.
Mastoid.
There we go. Sorry, I blanked out for a second. All the way across. Good. And then now you're going to come back, and now you're going to go down the cervical chain. Okay?
And you still
So-
do the little circular
circle,
motions
yeah.
as you're going?
Yeah.
Okay.
So we're going to do superficial cervical. Oh, yeah, right there.
Mm-hmm. I've been feeling that.
And did you guys learn what is a normal lymph node yet? 3 things that make it normal.
Mobility.
Good. The fact that it's mobile.
Yeah.
Yep. So this is posterior. So you're, it's pretty light. You can see, like, it's not very
very
firm
light.
that you have to push. So superficial cervical in the front is the most common one. Yeah, you have a couple actually. Teeny tiny.
Yeah,
completely
I can
normal.
feel
Yeah.
'em.
Posterior. Yeah. And the deep cervical is right on the sternocleidomastoid, pressing a little bit deeper. You will not feel these unless they're really, really enlarged. But it's right on the sternocleidomastoid. You can also do it this way, like pinching.
That gets both of them.
I can feel that there's something
Yeah, but the
there.
only thing is, I don't feel like that's a good way to
Because
feel
it's a
the
different
posterior.
sensation. Yeah.
But it is, if it was deep under the sternocleidomastoid, you would definitely feel it that way. But don't use this to do both of those.
Okay,
That's
so
what
you'd start with
I know.
superficial and then you'd.
Yeah.
Work your way down.
Deep, and then you're gonna do submandibular. Ooh, that one's enlarged on that side.
Yeah.
So you have a lot of interesting findings, even though you're
Yeah.
not sick. But this just might be your baseline. Submental's right here. You're never gonna feel it. Pretty much on anyone. And then supraclavicular is over here. So supraclavicular, you should never, ever, ever feel a lymph node here. It is always cancer till proven
bad,
otherwise.
yeah.
You are fine to do it like this, but the way to enhance it is you can take a big breath in and hold it, and then it kind of gets sunken. And make sure you go all the way over. If there, I can tell you right now, if there was a lymph node there, you would see it. Yep. Yeah. I mean, you still need to feel it, but if you ever find one there, that's abnormal. Always, always, always. So a lot of people, like at baseline, you probably have this one all the
I
time.
had mono, so maybe they're just stuff.
Maybe,
like that.
yeah. And a lot of kids have baseline lymph nodes anterior. Do you know what? You guys haven't learned it yet, probably. Posterior. Do you know what that goes with?
No.
Mono
Oh,
typically,
mono.
yeah.
Oh, okay.
Occipital tends to be meningitis. Mastoiditis is
makes sense.
preauricular and postauricular. Cancer, 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 cancer. Always, always, always.
Yeah.
Okay. Okay.
Wait, you know how there's the Hodgkin's and non-Hodgkin's?
Mhm.
Does one not have it and one have it?
Oh,
Hodgkin's
yeah.
tends to have more lymph nodes than
Hodgkin's
yeah.
does. Okay.
So mono, you're not gonna get it. Mono just because you're gonna learn it
Yeah.
in school. Mono tends to go with Hodgkin's.
Okay.
Yeah, and so typically at some point they had really, really big lymph nodes. It went dormant, then it turned into that later.
Got it.
Yeah, non-Hodgkin's doesn't have the classic. Okay, good. And then so neck, you're going to, so you're just going to inspect the neck. So you're looking at, I'm just looking at your windpipe, noticing that there's no lumps or bumps anywhere on the neck. Okay, now I'm just going to shine the light from this side and just make sure there's no shadowing. So if she had some nodules, like in her thyroid, much like when you guys did tangential lighting for the last OSCE and you were looking for that shadow, you're doing the same thing. is there a shadow? And there is no shadow. So if she had like a goiter down here, it would cast a shadow over here. She doesn't have it.
Does it matter that because should we do that first? Because I know they said they want like inspection, palpation, percussion, auscultation.
Yes.
Should
this
we
is
shine attention to
inspecting.
the lighting
Yes.
prior to feeling the nodes?
Oh no, nodes is okay because nodes are here. Your thyroid is here.
Oh, we're doing
Yeah.
thyroid now. Okay,
Yes. I'm sorry. Yes. So nodes are done. So now we're going to do thyroid. So
Got it.
you're looking at this region. So remember your thyroid is like a
Okay.
butterfly.
Yeah.
So that's what you're looking for. You're also making sure that her trachea is midline visually, and now you're going to double check it. So I'm just making sure your windpipe is midline. I'm just going to put one finger here. So you're putting it between her trachea. You can see her trachea, right?
Yeah.
Okay, and you can see her sternocleidomastoid. Put your finger in between. And do not do this. It cuts off your airway. It's
Okay.
not a good idea. Okay, cool.
Did you, I don't know if I missed it, for the supraclavicular, did you have the patient inhale?
Yeah.
Yeah, I
So,
went-
that's what, so on hers, you can already see it, and then look at if she inhales. It's just a little bit more.
Okay.
So some people that have really like a lot of muscle up here, it's a little bit harder, and you need them to.
You're gonna need to do
So humble, so humble. Okay, cool. So then thyroid. So I think thyroid was hard, at least for me.
It's hard
when I
to
was in
feel,
school.
huh?
It is hard to feel in a lot of people, and it takes a lot of practice. So the way that I think is the easiest way, I think Bates showed you just put your fingers here and you should feel it. You're not going to feel it. I'll tell you that right now. So what you're going to have them do is they're going to be sitting. You need them to be as relaxed as they can with their neck. Good, good. So the more relaxed your neck, the more that the thyroid will kind of bulge out.
Okay.
So what you're going to do is your thumbs are going to sit behind the sternocleidomastoid. So here's her sternum, right? Like a sandwich. My thumb's going to be behind the sternocleidomastoid. Then what I'm going to do, so you do not, this should not be uncomfortable for them at all. So what you're going to do is lightly, I'm just going to be feeling for your Adam's apple, okay? You guys know what the Adam's apple is, right? What is it called?
Hyoid.
Cricoid.
Oh, cricoid
Exactly.
cartilage. Whoops.
You can say Adam's apple to them. That's fine. So you're going to feel for it. Hers is right here. Do not press it. It's very uncomfortable. But that's what's going to be your gauge. So there it is. So now your thyroid is a butterfly from here down. That's what you should imagine.
It's that big.
Yeah. Well, it typically is that big, yeah. And it does not go above the cricoid cartilage. So your hands should not be up here trying to feel it. Okay? It's all down here. Your fingers are almost kind of resting on their clavicle, depending on how long their neck is. So the first thing you do is you feel the cricoid. Hers is right there. Okay, so now I know three fingers do not go above that cricoid, and they move off the trachea. You okay?
Yeah.
So if I push my hands, so now I'm making a sandwich with my fingers. If I can do that and she has no discomfort on her trachea, you're good. Okay, so cricoid first. Make sure her neck stays relaxed. Put your head down a little bit. Good, good, good. Keep your fingers off the trachea. So now what you're going to do, I'm going to have you tilt your head to one side. You would have already told her to put some water in her mouth. Sorry.
Oh, okay.
Oh, no, you're good. Put your head down a little bit. Okay. People's tendency is always to put their head back. The more extended their neck is, you're not going to feel it. So
Okay.
let's feel it again. Cricoid. Your fingers down. Come off the trachea. You okay?
Yeah.
Okay. So now, I know it's going to look kind of funky. So now what you're going to do, the direction that your head is tilted on, that's the side that you want to feel the thyroid on. Okay, so what you're going to do is these fingers on the other side are going to push underneath, like back towards your thumb, and then over under her trachea. And you're going to feel a bulge underneath these fingers. You okay?
Yeah.
And then you're going to swallow. So you doing any other way, I mean, if you can figure out another way to do it, wonderful. But as long as their head is relaxed, fingers off the trachea so that you don't cut off their windpipe, you push behind the trachea, this bulges out. You feel like this fatty blob thing right there. That's the thyroid.
Okay.
Then when she swallows, it's going to roll under your fingers. So all you're going to feel is like a fat blob under. Sorry, that sounds so
That's
bad.
fine.
That's what it is. It's just fatty tissue. So it's just going to feel it under. If she had a nodule, then you'd feel like the little marbles
Right.
roll under your fingers. Okay? So then what you're going to do, okay, and you can put your head back up to normal. Good. Do it again. Make sure you're not on her windpipe. Go ahead and tilt to the other side. Make sure her head didn't come up. So now this finger is going to go behind her trachea and then swallow. Sorry, I should give you some water. You okay?
Mhm.
Is it uncomfortable at all?
No.
Okay. It shouldn't be uncomfortable
Doesn't
at
hurt.
all. If you were off the trachea, this does not hurt. Pinching this.
So
Okay.
before all
Doesn't
this,
hurt.
she drinks a sip of water.
So yeah.
You tell her
So you're gonna
hold
have her
it.
get in position, put some water in her mouth. Sorry, you have to do isthmus first. So back to sorry. So first thing you're gonna do is cricoid. Put your hands on. She has a sip of water in her mouth, and then swallow for me. Good. then now, I just want to make sure I'm not on your trachea. Okay, and then now she tilts to the side. She takes another sip, or whatever, whenever you want her to take a sip. She swallows when you tell her to. Back to midline, take a sip, put it in your mouth, get in a position, have her swallow. Okay. So it's 3 swallows. One at baseline, because that helps them swallow.
Yeah, because it's hard. It's like dry.
It's real awkward. Yeah. But some people can do it. I mean, if you're chewing gum, then
I don't have enough in me.
Yeah, it gets really awkward. So it's just easier to have them do it. And you need them to swallow so that the thyroid moves under your finger.
So they're just holding a cup.
Yeah.
Sugar.
They'll have a water bottle, and then they'll give them a water bottle.
Okay.
Cool. And then the last thing is the Brewy. So you have your stethoscope, and then what you're going to do is, you already know where the thyroid is because you just felt it. So now what you're going to do is you're going to put the bell of the stethoscope on one lobe, have them hold their breath. You should hear nothing. Breathe normal. And then, again, hold your breath. You should hear nothing.
If you hear a noise,
that means there's turbulence. So that means, so you may not have felt anything when you felt the thyroid, like a nodule or anything like that. But if you hear, then that means something is in there blocking the
when
flow.
the blood flow's going in, it's like, okay.
Yeah, and you need them to hold their breath because if breathing interferes with that sound.
Does it matter what side we're using the diaphragm?
The bell is the smaller.
The
Yeah,
bell.
bell is better.
It's a special side.
Yeah, and it's smaller. It's
And
more.
where do we place that out? Like right.
So on the 2 lobes. So
And
if
what
here
would
is her
cause-
You check both sides.
this way, hold your breath. Let her breathe for a second, and do the other side.
What would cause that turbulence? In the
Any
thyroid
growth in
specifically?
there. Yeah, so nodules number 1 because
Okay.
it interferes with the blood flow.
Okay.
And it's kind of like a way of double checking. Like I didn't really feel anything when I was palpating because the thyroid exam is really, really hard until you've done it a bunch of times. So if you didn't feel anything, but then you did this and you heard the Brewy, then there is something in there. I just didn't feel it on my exam.
Okay.
Cool.
Yeah.
On this might be mean, but on like bigger people, is it harder to feel?
It is harder to feel.
Yeah. Okay.
Yeah, it's harder to feel because at baseline it's harder to feel our Adam's apple.
Yeah.
So if you can't find this, it's really hard to know where to go.
Mm-hmm.
But that being said, you can press. Like I was pressing pretty hard on your neck. It didn't hurt? You can tell me. Okay.
No, it didn't hurt.
As long as you're not on their windpipe, you can press really hard, and you're gonna push back toward you with this finger, and then underneath her trachea over to the side. So don't be timid with this because the lighter you push, the less chance you're gonna feel any thyroid.
Yeah.
Okay.
Okay. Is that it?
That's it.